Hello everyone, Kent Bressler here. I want to welcome you to Kent's Kidney Stories. During our time together over these podcasts, I'd like to discuss kidney disease. I'd like to tell you about my journey as a transplant patient, but also talk about dialysis, kidney donation, and just about anything else that might be of interest. Kent's Kidney Stories, podcast endorsed and sponsored by kidneysolutions.org. Hello everybody, this is Kent Bressler, and again we're going to do some podcasting. We're up well into our over 50 podcasts, and I want to thank everybody out there that's been listening. It's been a real joy having you listen in. And the conversation we're going to have today is with a very dear friend of mine who works really hard at bringing information and things into the community, into the kidney community. And we'll get to him after our prayer. Father in heaven, we stand before you today in your omnipotent presence to ask that you grant us strength. I want you to give me the strength to power through all the tasks we have to do today, with little, whether they're little or big. It is your will that I live on, Lord, and I know it is also your will that I will not go weak today. Your blessings are many. We are open to all of them. Help this talk with Peter today go well. We want to make sure that the kidney community understands the gravity of our situation, but the hope also. We ask this in your holy name. Amen. Okay, so the best thing about doing podcasts is that you get to bring, when it's your podcast, you get to bring on people that you really know make a difference. And today, the person that I'm going to introduce, Mr. Peter Maag, I've known Peter for a couple, 2 to 3 years, and he's been gracious enough to have me out to his company in California. And we've done some things with the AAKP and in the kidney space with Kidney Week. And just in general, this guy is a world-renowned pharmaceutical expert. And I just want to invite him in today, and we're going to talk. Peter, good morning.
Good morning, Ken. Thank you so much for having me. I mean, following you, congratulations, more than 50 podcasts now in the space. I come to work every day to care for people like you. And it's such an honor to be with you because, we focus on transplant patients, we focus on kidney patients, and that's all what we do. And now being here with you means a lot to me. So thank you very much for having me.
Well, I'm great. I'm very grateful because you're a wealth of knowledge. The greatest thing that I think when I think about CareDx is how fast it's growing. It's marvelous, and you've been the leader of this growth. And I know you got a lot of people behind you. Tell me a little bit about your focus at CareDx. What's really going on with CareDx today?
We at CareDx, we focus on transplantation patients and focus on the transplant patients throughout the patient journey. And the transplant patient journey really starts with being on the wait list. And every patient that's on this podcast and is on dialysis or has end-stage kidney disease, please consider transplantation and please consider that journey. And it starts with being waitlisted. And that often takes a long time to be waiting on a wait list to then get this life-saving transplant. And then once you have a transplant, there are a lot of things that are happening in where CareDx can help you. But we already today help patients on the wait list with many transplant centers in the country. Then we help them to match organs with recipients with our latest technology in diagnostics. And then after they receive a transplant, we care for them throughout the lifetime with monitoring their transplant's health. And that's what we do at CareDx. And because there's such a big need out there, yes, CareDx has been phenomenally growing because there is so much need for transplantation, but also so much need for better care of transplant patients.
Kidney Solutions, that's my 501c that we talked about in the past. That's our main focus, is the journey. It's not so much about finding a donor, being a donor elicitor. It's more about, working with the patient early on, getting them prepared, getting them through the transplant, but then taking care of them in the interim after they've had the transplant. That's the transplant process is not that difficult. What's difficult is taking care of it after you got it.
Oh, absolutely. And Ken, we at CareDx, we have a theme. It's called "It Takes a Village." And there's so many individuals involved in this, and, for those of you that are listening on the podcast that are caregivers, you always need to have a buddy system, or you need to have other people that are really caring and supporting. And it's way beyond the transplant center. So it's the entire village that needs to come together and caring for that transplant patient or that end-stage kidney disease patient. And I think being part of this is very, very meaningful, but it also means that there's so much involved that we can do a lot more. And I think it is important that we realize that, every transplant center is doing things a little bit different.
Yes.
But at the end of the day, we can actually do a lot more to connect the dots between the dialysis to the transplant center, from the transplant center to the community nephrologist, that there is a continuous experience that is all centered on the patient versus, sometimes it's a little bit centered around the procedure.
Yes, right. That's exactly correct.
We want to focus on the patient.
Well, this concept is marvelous because it does focus on the patient. It gets them involved. And, patients don't do well unless they're their own advocate, unless they're the ones that really want to do this. Once they've done the process, some of them don't understand how to get there, but once they're there, how to take care of it afterwards. What kind of products does CareDx have to cover the post-transplant arena?
And Kent, that's very important, but let me start. We have dedicated patient care managers. We have people and humans that are helping. And I think that's the most important one. These more than almost 100 patient care managers that we now have at CareDx, they're beyond what a transplant center almost can offer, because we do focus on waitlist all the way through the post-transplant care with our capabilities and products. One engagement tool, which is very important, is our Allosure product, which is a an app that allows you to connect the data and maybe connect with other patients that have an experience. So Allosure is so central to how we're thinking about patient engagement, because we don't want every transplant center to reinvent the wheel. I think you as transplant patients or pre-transplant patients should have a unique and one platform where all the information is happening with the connectivity. So think about Allosure. On the post-transplant side, the product that is really the engine of CareDx is focused on sequencing technology, which is the latest technology in diagnostics. So in a way, we are a blood-based diagnostics company where we take a single drop of blood, and that allows us to measure the health of the organ. So if you have Allosure or AlloMap, these are our diagnostic products that help us to monitor the health of the transplanted organ. And these have been, adopted in most transplant centers in the country. An amazing, amazing ability for us as a company as well to do more and more going forward, because they're really the technological backbone of everything that we do.
Yep, that's the area that I was really interested in, is making sure, does CareDx do anything in the field of rejection?
Absolutely. And this Allosure product, it monitors the health of the organ by looking at, the cell turnover of the transplanted organ. What you normally have in any organism is that cells are turning over. And if on a regular basis, everything is good, but if there is a rejection reaction, then you have increased cell turnover. And CareDx has perfected the technology for transplant patients to detect this cell turnover in patients And so we can actually detect these cells as they are circulating in your bloodstream. And this technology, it's Allosure as a product, has been adopted in more than 150 transplant centers, tested in thousands and thousands of patients.
Yeah.
It's reimbursed by Medicare because it's such a contribution to the field. And it's the latest innovation in transplantation. CareDx is the first one that brings that innovation to transplant patients. And you can probably tell by my voice, I'm incredibly excited that more and more patients every day are getting monitored with Allosure, our post-transplant surveillance solution.
Well, that surveillance is real important because I can tell you what, nobody really wants to undergo a biopsy. I know very many acquaintances that have had 1, 2, 3, 4, 5 biopsies. And I know this does not replace that, but maybe in someday the technology will get rid of that sticking a needle in your kidney.
Oh, Kent, and I think it is replacing it already today. More than 30% of all newly kidney transplanted patients in the United States already receive an Allosure in the first year. What's so important, however, it's that we can do that more often. Because think about if you want to do a biopsy every week or every month. No, you can't. You shouldn't. Because of the vascularization of the kidney, there's a lot of blood flow around the kidney. Mm-hmm. So you can't stick a needle into your kidney too many times. But you can do a simple blood draw with all your regular blood work, and you can do an Allosure. And what's so important then, Ken, however, that we do that protocolized, that we follow a regimen. I think in transplantation and post-transplant care, a lot has to do with being very rigorously focused on following a protocol, taking your tablets every day, following up on your doctor's visits, getting your blood works done, doing your labs done, thinking ahead of the curve versus, not just looking at problems, but looking before problems occur. And there's where Allosure is so important, that we can detect rejections early and maybe even before they really happen. And that's why you need to do your blood work. And with CareDx, this protocol, we have established these 7 tests in the first year after transplantation, and then the quarterly follow-up. And that has taken the field by storm. So many transplant centers, and it's now more than 60 transplant centers that have a very specific protocol on Allosure that allows us to monitor these patients. The team is doing a phenomenal job of being so focused on really following a protocol.
So the protocol itself, it's all lined out, and these institutions that are using it, do you see it spreading quickly, or is there kind of pushback on it because like we'd rather do biopsy? That's a technical thing that we can do, and we've got residents that can do that, and we've got. So I personally would love to see that biopsy go away. How about Preemptive, like FSGs, that horrible disease that nobody knows a whole lot about? Is there a connection between Allosure and that, and the what we call rare diseases? Is there a way of using that in detection of rare diseases?
It is really focused on the transplanted organ. So Right now it really picks up the DNA of the transplanted organ in the bloodstream of the recipient. And we're building the platform for more and more and more addition. For example, right now we just work on infection, that we actually also can detect all the pathogens that are associated with it. And maybe this is where you're going is, we don't see a single test is the right thing to monitor a patient. Mm-hmm. It is actually so many different data points. And maybe it's even, how well did you sleep, or how many steps did you take, or, how do you feel? So I think we want to, at the end of the day, we want to care for the transplant patients. And that's why we are called CareDx. We want to care. Yeah. And data and diagnostics is one element, but it is really the surround sound, the village concept that's so important, that we have an entire holistic view on supporting the patient through this patient journey. But I think we are on that technology so early. And I think it is this connection between human. And that's why I answered your earlier question with it's humans and technology.
Right.
You cannot just rely on an app and I give you an app and you go do it. No, it needs to be the human touch together with the technology that allows us to care for people.
Well, picking up the phone and calling a mentor, picking up a phone and calling somebody that's had the experience. I know that works. Over my 30 years with my kidney, I've known that I've had people that I can pick up, including physicians, when I'm stymied, I don't understand what's going on, I can pick up that phone. That's a human element.
And Kent, that's why I'm going so happy on your podcast, because you're doing and you're leading what should be happening. More communication, connecting the dots, having more people interact and learning about things, that are specific to their problem or their issues or their conditions. So, this podcast, and I hope that all of you that are listening are hearing there is a genuine interest in your concerns, and maybe we can help to connect the dots, connect you with an individual that has gone through exactly the same problem that you're facing today.
Absolutely. In the world of FSGs, I can speak to that because I've had it for all these years. The point being, when you do have a rejection with FSGs, it shows up, and that they do the biopsy, they can see that it's actually being caused by a reoccurrence of the illness. And that's, I think, the connection I was hoping I could hear from you, is that are you going in that direction? If you do,
yes, absolutely. There are different subtypes and the different specialties. And I think it's important that we are supporting the learning. That's why we do clinical studies with large patient cohorts, so, you need to understand different patients and different subtypes or different special problems, because at the end of the day, every transplant patient is very unique and special in a way, but you are following certain patterns.
Well, the human element's always going to be there, and if the person is not ready to accept what's going on, and it's not going to take care of themselves, you always have to interject with them. And having a tool like this Allosure sure sounds like a good thing to me. It sounds really good.
Absolutely, Ken. I think it's important that we realize that we're not alone. But at the end of the day, there is also a personal discipline. And why are not working together? I can tell you that, sometimes we need a little bit of extra push from others in order to do it, but it is, it starts with your own energy, but then sometimes we all can help a little bit of a bump from the outside to keep us on track.
Everybody likes good news. They like to go into the doctor and they look at their creatinine level and their GFR and how good this is. And a lot of people become numbers people, but I don't see that with this CareDx model. I think that's what's striking about it. It's not all numbers based. It's really actually human based also. And hard to separate those two, but it's a good thing what you're doing. I really like it, the concept.
And Ken, this is so important to us because we're also talking about what I think you're referring to is the green light patients. Doctors and caregivers, sometimes they're so focused about rejection. They want to find rejection. And I tell them, no, there's so much value in this peace of mind. I call it the peace of mind score, POM. Yeah. Because, it's so refreshing that you say, hey, the light is on green, you're good. Yeah. And to a patient, that's such a positive message, right? While the doctors always wants to find what's wrong with you in a way. I'm joking a little bit. There's tremendous value in saying, hey, you're good. And having a low Allosure, which is our donor-derived cell-free DNA product, and having the Allocare score allows you to keep on monitoring the health of the organ.
See, because we've relied over the years on these two structured blood tests, GFR, which is insignificant almost in transplantation patients, and then the creatinine level. And those don't always adjust very quickly. I mean, you can have an issue.
And, with serum creatinine and eGFR and these, they're really only functional tests that tell you once something has gone wrong, these tests tell you something has gone wrong. Yeah. What we're trying to do with Allosure and our technology is to catch problems early, to move you into, detecting rejection before it leads to dysfunction. And so that's critical, so that we continuously monitor and do surveillance on these patients. So we have an early warning system in a perfect world to keep caring for these patients.
See that. What we're focused on at Kidney Solutions is preemptive transplant. And I have to be honest with you, I think we would love to keep everybody off of dialysis if we could. We try to get people that are, stage 3 or better and work with them before they end up in the intensive care unit or the emergency room. And before they get to the doctor's office, they say, well, let's watch this now for a while, and then we'll just make a decision. And then they wait till the end when they're so sick, it's hard for them to find donors. And all in all, I think the preemptive arena is opening wider now, and I think we need to embrace that. What is your thought?
No, absolutely. We have 100,000 patients on the wait list for a transplant, and it takes in many cities in the US years and years to be transplanted. And the earlier you're starting in that journey, the better it is. I think organ availability is so important, and I think it's also important that we're spreading the news that people should become donors. And then once you are in this end-stage renal disease, make sure that you very quickly go on the waiting list and you evaluate the options. Living organ donation is a really, really good opportunity and possibility for you to significantly improve your quality of life and your outcomes. And so I would encourage everybody to think about your various options. While CareDx focuses more on the transplant patients, we have a strong dedication on caring for patients that are on the wait list and making organ donation available and more readily available. There's so many patients on the wait list that maybe we should even have more patients on the wait list to continue to force the system to make more organs available.
Yeah, that forcing of the system is what's diabolical, because we can't embrace that yet. I think there's a whole lot of static or inability to accept the fact that it's okay to say go to transplant first versus dialysis.
Oh yeah, and I think it has a little bit to do with the incentive systems. I would call out the kidney initiatives and the
Yes.
executive order, and I think that's all positive in the sense of acknowledging that kidney care is so important. And we see ourselves as a transplant focused company at CareDx as being the part of the tip of the spear to make that happen, and to make sure that patients realize that transplantation is a very good alternative or an option to focus on their quality of life. But I think the incentives in the US healthcare system need to be aligned, that people are looking at dialysis, they're looking at preemptive transplantation. So we are making the best choices for every single patient that is possible.
Right, that is, and it's patient choice. We want them to have the opportunity to say what it is they want, what they give them the options and let them make the decisions. And I think the models that we're seeing out of CMS and out of Medicare, although they're voluntary, at some point in time, I think the preemptive part of it's going to become more and more important.
Oh, I think it's very important. And I do think that, I'm calling on the dialysis organizations in the country. They have a big responsibility that this information is spreading, and it's spreading fast, and that patients have the information to look at their various options in the continuum and through this patient journey. So, I do think that patients with end-stage renal disease should probably be given more information than more option, and have the ability to maybe chart a little bit the course that they want to be on.
I could take that a step farther and say they ought to be the drivers of that. Without information,
I think a lot has to do with having good data and good information.
Absolutely.
And I would call them out and saying, hey, we have such a big responsibility that the information on these patients is continuously monitored and managed from pre-dialysis to dialysis to post-dialysis and transplant. And there are so many discontinuities that we at CareDx said, what can we do in this problem? And so we have acquired transplant-specific electronic medical record options, where we are now managing the electronic medical records in about 70 to 90 transplant centers in the country. And we're trying to help dialysis clinics and transplant centers to create this continuum of care, that we are patient-focused and not procedure-focused.
Exactly.
There's so many healthcare professionals that are focusing on the procedure. We should be focusing on the continuity of the patient and the patient journey.
Well, you know people like Kevin Fowler and Derek. They all say it's up to us. It's not, we need help, we need an assistant, but we need options. That's what we need. And that's not freely given in this system right now. It needs to loosen up, and CareDx, I think, is an innovator.
Thank you, Kent, because I think it's important that, there's so many slivers, there's the
Yes.
dialysis, and then there's the center, then there's the community, and everybody's just focused on what they do versus the continuity of care along the transplant patient journey. And a little bit has to do with the data integration, and so we recently have brought on one of the, a leader in interconnectivity of data. But the more important one is that there's a human element that follows the patient along that journey, that you have a bit of a buddy system, that you have connectivity with individuals that manage you through this, and the good thing is it's a years long journey. It's many years, decades, so it's not something that you go and fix. You need to have, long-term discipline to manage along that journey.
I think the term discipline is right. That's what patients have to have. That's what physicians have to have. But the overall, if you don't have options, if you don't have the ability to connect the dots, as you say, you don't have much chance, because you all then just rely on the technique and the procedure. And you're right, totally right. So the concept of continuum of care, that's been a nursing diatribe for years, and it's worked. So that's what we want to see continue. I see CareDx doing that. What other things in do you have that you can explain CareDx?
We focus on the matching as well of the organ and the recipient. That it's very important that we actually match organs and recipients to the best extent possible. We have the latest technology in order to do that. I'm also very excited because, down deep in my heart, I'm also a little bit of a technology geek, that we want to make sure that this is perfected. We do have the leading product that allows us to match patients and recipients, on the one hand, to the best information possible, but also sometimes we need that information very quickly. And so we have the quickest matching technology available. So we have been innovating in that space, and there's a group in Australia that is working night and day to continuously perfecting it. And that's so exciting for me as well, that we, this is the combination of technology with the human element. Because, at the end of the day, we want to make sure that there is the best possible match of a recipient and the donor.
Well, that's true. And you expedition of this, expediting it down the road, it's very important to do. And you do, if a transplant center only is going to test one person, all right, per patient, I want to get a transplant and I've got 5 donors, you're only going to do one at a time. That's a hold up in the system in itself that needs to be addressed. And these tests should be pretty good at matching that and expediting that process, in my mind. Is that right?
Oh yeah, absolutely. And I think we want to move almost away from only matching. I call it also qualification. You want to have the best organ that fits to the best recipient in that context. Sometimes transplant center, and I think this is a strong push, they're only waiting for the perfect organ.
Yes.
And, we probably shouldn't wait only for the perfect organ. A good organ is also okay, right?
Yep.
Because it's such an improvement of quality of life of the patient. And so, we should have more conversations around, do you want to be 5 years on the wait list and wait for a perfect organ, or until your situation deteriorates? Because that's what you described earlier. The system is kind of, you have to be sick in a certain way in order to then get the organ. That doesn't make too much sense for the health.
No, it doesn't make sense at all, Peter.
And so getting maybe after, instead of 5 years a great organ, getting after 3 years a good organ is maybe a good trade-off. But there you need to have qualification on both the patients and the organ, and to make sure that there is a good matching process. Again, this is data and that's technology, and CareDx combining this with very, very great relationships with every transplant center, because every transplant center is again doing that slightly differently. And I think there could be a lot of cross learning. where somebody like a CareDx that has ties into many transplant centers can bring the best practices and the learnings together. We have there a team that does that with our XIN management. We are comparing the quality management of about 40 transplant centers in the country and allow them to learn from each other, which is incredibly important.
I really think that's where it's at, because every transplant center, I don't know how many there are in the States. I used to know, but I don't anymore. But they're all regulated, or not regulated, but they're all searching for a way to keep their stats right, so that they don't get out of bounds with rejections and with failures and complications. And so you lose that human element when you're doing, that type of observation. I think it's really important that we have something that allows the individual to be part of that whole process.
No, Kent, I mean, there are more than 200 transplant centers in the country.
Yeah.
And
yeah.
I think it's important that we continue to build that interconnectivity. The world comes together very quickly, and that we continue to learn from each other. You're right. I mean, these transplant centers, they are working under tremendous constraint on quality and focus. And, it's they're trying to do their very, very best. And I have huge respect for the transplant surgeons.
Oh, gosh, yeah.
For those, they're amazing individuals. But maybe sometimes taking a step back and saying, hey, what can we learn from the entire group versus just looking at the stats and saying, hey, where can we take a little bit more risk, or where should we take a little bit less risk? And that's on a patient basis. That's what we're all about, because at the end of the day at CareDx, we want to be a precision medicine, a personalized medicine company. And transplantation, what wouldn't be more personalized than receiving an organ from somebody else? So personalizing that care while then learning across the board from all the transplant centers, that's what we're about at CareDx.
Do you think in your conceptual mind that it's possible to take 50 or 60 or the 200 and actually get their processes together electronically?
I don't think
is that possible.
I think it is important that we learn from each other, and that we have, for example, in our clinical trial that we do with KOR, 55 transplant centers have treated 1,500 patients the same way with the same surveillance protocol.
That's what I'm talking about right
and
there.
That was, for me, in terms of CareDx's focus on clinical trials and excellence and protocol surveillance, there very few, if any, for the first time, the kidney community came together and said, this is how we care for these patients on a very, very large scale. It hasn't been done before, that there are 55 transplant centers doing the same way the surveillance on these patients. So having that level of standardization, Ken, which I think you're talking about, to then learn what's the best practice, right? Once you have set a standard, you can see where am I deviating from that standard. That's so important.
Then let the centers make a decision how they're going to embrace it.
Absolutely, and then once you have set the standard, how do you want to deviate the standard? But it's so difficult, to personalize something when you don't have created a first standard, because how do you personalize from a non-existing standard?
Right, you have to improve on a standard. If you don't have it, it's hard to improve on it.
Exactly.
Okay, I could go on with this all day long. I really could. I would love to. At some point, we've got to kind of try to meld it all in. Tell me what it is that you would like to get across to the kidney patient right now. What would you tell them, to whether they're end-stage renal disease or they're post-transplant, they're anticipating transplant? What information would you give them? What would you want them to hear from you and CareDx?
I think most importantly, number one, you're not alone. I think others have gone through the same journey and are advancing that same journey. And I would like you to know that within CareDx, it's a caring organization that tries to bring the transplant village together, and that transplantation is a really good option for many, many patients. I think it's important that you create this village, that you create the this group of individuals, and it's not going to be simply one, it's probably going to be a multitude of individuals that help you to follow through that journey. But I would also want you to create a lot of hope, because there are so many that have managed this extremely successfully. And there are a lot of individuals, not only here, Peter, but also at CareDx and at your transplant center and in your community nephrology center and your dialysis clinic. There are a lot of individuals that are very passionate about your health. And so managing this, on a long-term basis, but having the discipline and the rigor to follow a certain path, and then really be very focused on actually executing on it and doing it, is very critical. And then don't be too hard on yourself. If it doesn't work for 1 or 2 days, there's always the next day. Right? So I also think that it's important to realize that we're all humans, and we'll help each other in order to move things forward.
How much better? I'm telling you, that's a great ending right there. I want to have you back. I want to have you back again at some point in time with maybe some of your people, maybe a couple of your engineers, or your group of scientists, or whatever it is you would think would be good to come on. I would love to have that happen.
Anytime, Kent. And we just announced what our focus on research and development for the space. And with our success at CareDx, we're caring for so many more patients every day. There also comes the ability to do more research and development. We have now a research and development budget for transplantation and end-stage kidney disease, which I think, is very significant, and it allows us to continuously innovate in the space. And so by adopting Allosure and Allocare and supporting CareDx, you're not only helping yourself, you're also helping to advance the field in going forward. And there's so much more to learn. I think it is important that people realize that what you're doing not only helps you, but it also helps the greater good of driving innovation. And sometimes in healthcare, the need for continuously innovating and pushing the envelope to the next barrier, because we want the next generation to be better, is sometimes not in the immediate focus. So think about, with the help of Allosure and Allocare, you're actually pushing and helping the field forward.
All right. I want to thank you from the bottom of my heart. We're going to have you back, and that's just all there is to it. Let me talk to my folks, and stick around a minute, will you?
Absolutely. Thank you so much, Ken.
Okay, fellas and gals out there, this whole process of kidney disease is not fun, but there is hope, and there's a willingness of people to help you. So don't go it alone. If you stand up, you've got a new diagnosis. If you're looking for a kidney transplant, if you need help dealing with your dialysis, bear in mind that you're not alone. There's somebody out there that can help you. Kidney Solutions is here to do that. Give us a call. We're a free institution. We don't charge anything for our services, and we have a multitude of services. Just go to kidneysolutions.org. And once again, thank you, Peter Maag. So folks, keep breathing.